neither of you need any introduction, but we have here Dr. Jason Ellen, president and co-owner of Oklahoma Medical Eye Group, and then Dr. Chad Chamberlain, medical director and also co-owner of Oklahoma Medical Eye Group. So take us back to the very beginning of OMEG, when it was just an idea starting to form. How did this all come about?
I think it was one of those early morning, sporadic, I wanted something a little different, a little more that was driven from Tulsa. And I don't know if anybody's ever seen the movie Jerry Maguire, but it was a letter that was written and without thinking. At that same time, Dr. Chamberlain was looking for a different avenue to practice, a different goal. We brought together a symbiosis of idea and philosophy of a family-based referral practice, surgical practice.
And Dr. Allen and I had worked together on several patients in different practices. And I think we realized our perception and our approach to patient care as a whole and to staff is a little similar. We were able to develop a practice that embodied the philosophies that you and I both have towards patients. That's putting patients first.
And then so that patient first philosophy, and obviously that is a very important one. How do you create that culture here at OMEG, do you feel?
I think it starts with how we treat our employees and how we reflect how we want our patients treated. And even everyday decisions are just drilled down to what the patient needs. And all of our justification is based off what the patient needs to experience.
I think the same thing is there's always financial decisions, there's always political decisions, there's always what's best for the practice, but what's best for the practice is what's best for the patients.
Right.
And when you, again, surround yourself with both staff and doctors who believe that wholeheartedly, it makes it easy for the practice to present to the patient what's best for them and keep their best interest in mind.
Yeah.
Which again, in referral-based practice, a lot of the times that's symbiotic with the referring doctors that already send the patient in. Many times we're sending them here because our philosophy is similar to what their philosophy is. What's best for them comes first.
Yeah. I think of the saying, birds with a feather flock together, right? And so that's,
What makes up OMEG is the differences between all of us, that we take that, again, all of our differences and all our abilities to focus on the patients that are in our office. And if I don't know the answer, I know somebody in this clinic does.
Yeah.
My answer is always right, but I've learned to be humble in those situations where having expertise from others grows. Even as a person, I think one of the things in any practice is you want to become better at what you do, no matter, even if you're almost 50 years old and been doing this for 20 years. I find that who I get to work with helps me see something new and something better. One thing I don't personally enjoy is the cosmetic aspect, but I think that's something that Chad has brought that expands both OMEG and our services. But I love the fact that we get to offer that through specialists and specialties that otherwise never would have.
Yeah.
Same thing with dry eye.
Yeah.
Same thing with refractive services. Having those on board that bring that passion makes me feel better about the overall practice.
Can you give sort of a summary of all the different locations that OMEG is providing services to? So
one of our core philosophies was bringing the care to the patient. Again, that's patient first versus financial first, because it's not financially, it's not the most financially lucrative decision to make, but going to places like Henrietta, Okmulgee, Okemah, Cushing, Tahlequah, Bartlesville, providing both clinical care and surgical care to those small town locations is greatly appreciated by the patients, by the doctors in the community, as well as the hospitals, which a day or two of surgery from OMEG physicians may generate more in surgical volume and income for a small hospital that actually helps them survive compared to bringing them right here.
Yeah. Looking forward then, let's say, we went through 5 years, celebrated OMEG's 5th birthday. Looking kind of 5 years down the road, what kind of things would you like to see, or what direction are you guys headed in terms of where OMEG is going?
We're building a new building, of course, which is going to more than double the size of our facility that we are.
Right.
And also bringing on new practitioners as well, because we were blessed to actually outgrow our current new area within 6 months of getting here.
Wow. What's a funny quirk that you've learned about each other just over the course of working together for so long?
I don't have any quirks other than if you watch him come into the clinic, we call him a pack mule because he carries both family and home and clinic with him everywhere he goes.
Right. Yep.
So,
It's all intertwined, right?
It
is.
Yeah.
It is. It's 70 pounds I carry.
Yeah.
It keeps me in shape. So,
Yeah. Good. So Dr. Slama, you are the head of our dry eye department, and Dr. Priester, you are our ophthalmologist, our cataract surgeon, and refractive surgery surgeon. You've both been with OMEG pretty much from the get-go, right? And so what are some of the highlights that you guys have seen over the last 5 years?
Well, the first thing I've noticed is I started over on the Harvard office, but moving over here to our new building has been a huge step up. I mean, it's much nicer, much newer, great parking,
Yeah.
and probably most important for the patients is easier in and out.
And obviously, you know, technology and cataracts has changed a lot as well too, right?
It has.
Yeah.
Yeah, when we were over there 5 years ago, very little, upgraded lenses, multifocal lenses.
Yeah.
Now with the newer Panoptics, we have very happy patients and they can see
Yeah.
really very well with few glare and halo issues.
Yeah.
And so I think the technology has moved forward
Yeah.
greatly and we're very thrilled to be part of that.
That's awesome. And what about you, Dr. Slama?
Yeah, so we started a dry eye clinic at OMEG. We do have the tear lab, the Inflamadry,
Yeah.
also the LipiView, LipiScan, and we do a LipiFlow.
Okay.
We have intense pulse light that we can use in telequat, and then also we have a laser that can treat ocular rosacea. It used to be mainly drops and punctal plugs, but now having these new testing and tools, it's really been able to evolve our dry eye treatments and help those patients that are struggling more with meibomian gland dysfunction.
Yeah. Dr. Priester, patients love you because, you're so experienced and amazing at your craft, and, you've been able to see cataract surgery evolve throughout your career as well. How do you stay at the forefront of cataract and refractive surgeries?
Well, first of all, I was lucky when I started in my training. I got to watch my trainers go from extra cap to phaco. But I try to go to as many CME classes as I can. I love going to the American Academy of Ophthalmology.
And what's great, Dr. Priester will always come back and have notes from all these meetings and educate, the surgeons and the optometrist on what she's learned. So that's always been real helpful.
Yeah, so the whole team gets to improve and learn based off of your learning,
Yes.
which is great. And there's something quite unique about your care for your patients afterwards. Do you want to share a little bit about that?
Yeah, so, I'm lucky enough I've got to work with Dr. Priester, was it 8 or 9 years now?
Yeah.
So I get to see a lot of her cataracts, lids, you name it. And one of the things that immediately patients say when I walk in the door that they just love Dr. Priester, that they got a phone call from her the night before saying how much she cares about the patients and how well they're seeing, and they just felt comfortable and calm and confident in Dr. Priester. So that's one thing that I hear from patients.
My old partner, Dr. Mills, used to do that.
Yeah.
And I picked up on that, and it helps because a lot of times I'll ask the patient, have you been able to use your drops? What drops? And so I get to do a little education and make sure they're doing what they're supposed to do. Or if they have any questions about, my pupil's still dilated. Yes, it'll be that way for 24 hours.
Right.
And, I can kind of
ease their worry a little bit.
Yes, make sure that they're not worried about anything that is a normal thing.
Totally.
So, yeah.
Dr. Slama, you are originally from Minnesota, right? So why Oklahoma?
Good question. I get that all the time. Patients ask me that, I think, on a daily basis.
Yeah.
So, originally from Minnesota, did some optometry school in Memphis.
Yeah.
And I had to choose to do some rotations for school. And originally was actually not going to even come to Oklahoma. I was supposed to go to Texas and Iowa for my externships.
Right.
But that kind of fell through. And Dr. Ellen, one of the owners here at OMEG, chose to take me at the last minute. And it evolved from an externship to a residency. And I've been here for 8 years since.
And you have a really strong rapport with the referring doctors as well, right? I've seen that, you will refer back and forth and there's a lot of strong communication. Can you talk a little bit about that as well?
Yeah, absolutely. So again, being a referral center, we tend to do the cataract surgeries and the lid surgeries and dry eyes. And doctors will send to us for those specialty cares and treatments and testing. One of the big things I always like to do is get back to the referring optometrists and physicians so that they can keep managing, for doing their yearly exams, for their glasses, because that's not something that we do here on a daily basis. So we like that rapport of going back and forth with the referring doctors to make sure that they can continue to see their patients that they've been seeing for years, and we can help out on the surgical and disease side.
For the referring doctors that may not know you both as well, what's something kind of neat or sort of a fun fact about yourselves that you guys could share for them?
But one of the things that I know we both do is we like to go to concerts.
Hey, awesome.
We're always talking about
what's the latest concert?
what's the latest concert you've been
Not with
to?
COVID.
Yeah, that's true.
I think my concert days are over.
Oh, no, don't say that.
Well, I'll say one other thing.
Yes.
Since I have a little bit of free time when I'm not working, my husband and I have been traveling, and we have our bucket list going, which is seeing all the national parks.
Hey.
All 62 of them.
Wow, okay. How many do you have checked off?
Probably about half.
Okay, all right. Well on your way.
Yeah.
Which is good. That's exciting. That's cool. Dr. Sturm, you are the head of Refractive Services, and Dr. Hadel, you are head of glaucoma. And so tell us about what's new and exciting in these areas in OMEG right now.
Well, for refractive services, the exciting thing is bringing refractive into the practice, because forever the surgeons, Dr. Priester and Dr. Chamberlain, were accessing, like Enjoy Vision or a laser elsewhere. And so as of now, we're doing all the refractive procedures inside of this practice, which has been very exciting to get that launched and started. And Dr. Ellen and I have always had the goal of being under the same roof, and it finally came to fruition here in 2020. So that's been pretty exciting for us.
That's very exciting. And what about you?
For the glaucoma surfaces, the MIG space is kind of changing a little bit here at OMEG. We've always had the eye stent, and we've done the hook as well, but now we're starting to introduce the Omni as well, which is exciting because it's targeting a little bit of a different outflow pathway. Our eye stents and our hooks have traditionally targeted the trabecular meshwork as the major point of resistance, but the Omni is taking that and kind of adding, expanding the collector channels and dilating Schlemm's canal too. And so hopefully we're going to get that rolling here pretty soon, and we're excited about that.
Cool. That's awesome. OMEG has recently celebrated his 5th birthday.
Yep.
And so what are some things that you both are proud of as being part of this group?
Gosh, I say on the top of that list is probably the people that I get to work with. From doctors and staff and admin, people from the front all the way to the back. The environment that I get to work in is really exciting to be a part of that. People are having fun. People have the same vision in mind. And if you just sat a chair out there and watched everybody work, say, well, how is this not just a great place to work? So the most exciting part about for me anyway is the people that I get to work with.
I definitely would second that. I've always been kind of on the outskirts of OMEG for a long time, and then joining the team in 2020, I felt like I was home, and that's been really exciting, and it's a fun place to be a part of. It's a big family and an ever-growing family, and so, but then the probably the expertise as well. I think everybody takes everything very seriously, and getting to be with people that really are experts in their field has been incredibly rewarding. So.
And we spend 8 hours, sometimes 10 or 12
Right.
a day with these people. So
Right.
it's good that we're spending all this time with people we love to spend
Right.
time
Yeah,
with.
exactly, and have fun. I mean,
Yeah.
that's
Right,
exactly it.
right.
So, especially Dr. Adel.
Kind of a big
Fun
deal.
master. Yeah.
Fun
Yeah.
master.
There you go.
All right, well, Dr. Sturm, you know many of our referring doctors, right? And you have a chance to work with them really closely as well. But what is something that they may not know about you?
I remember back whenever I was going through the seats of the presidency for the OAOP, I actually had 2 male, older doctors who were being very loving and kind and concerned about me, actually tell me that they were very concerned about me taking on that role because I had children, young children. And it kind of highlighted for me the need for, women in our profession to hear just a different voice, if you will. And so that's always been really important to me. I had the opportunity to be part of an executive women's group, learned a lot, and just want to mentor the women of our profession, because we're 50% of the profession now, so a lot has changed. But it was important to me that, women in the profession actually have just hear a different voice.
Yeah.
So.
That's awesome. Cool. Dr. Hito, I heard you're kind of a KU fan.
A little bit.
Okay, so here's the question. What would you choose? $1 million or KU wins the National Basketball Championships?
How many championships? How many years in a row?
Many.
Well, those are my two loves.
Oh,
Money and KU.
okay.
Okay. And your family,
That's
right?
not-
$1 million or KU wins the National Basketball Championships?
I'm gonna take the $1 million on that one, though I'd like to see the other one happen.
Okay.
But I think about all I could do with that $1 million. Invested in a fine company like OMEG. Buy my family something nice.
He's recovering.
And
What's wrong with my hips?